Okay, we are live. Okay, so
Yes.
good afternoon, everyone, and
Good
welcome
afternoon.
to our webinar this afternoon, Taiwan versus COVID-19, Standing Up to the Challenge. So this webinar is a part of the Asian Center webinar series called Living in Guyub. Guyub is a Bahasa Indonesia term, roughly translated as in togetherness, a perfect way to describe our unity in diversity amid this pandemic. So hence, for the coming weeks, we will be looking at COVID-19 pandemic using an interdisciplinary and multidisciplinary lens with the help of our various experts and professionals. We aim to make this webinar series a platform for knowledge exchange among students, faculty, researchers, and other professionals to better understand and respond to the current challenges of the public health crisis. So to give us the opening remarks, may I call the Dean of the UP Asian Center, Dr. Jove B. Santarita.
Thank you very much, Danae. Ambassador Michael Peyong Tu,
Thank you.
Professor Guido David, distinguished guests, colleagues, friends, good afternoon. Wuhan, the Asian Center, one of the graduate degree granting units of the University of the Philippines, is mandated by the Republic Act 5334 to develop a closer and broader contact with our Asian neighbors in the field of learning and scholarship to attain knowledge of our national identity in relation to other Asian nations through profound studies on Asian cultures, histories, social forces, and aspiration. Thus, the Asian Center is the place to locate Asia in the Philippines and understand the Philippines in the context of Asia for the past 65 years. This is the reason why we launched this webinar series, Living in Guyub. As mentioned by Ms. Pantano or Danae, Guyub is a Bahasa term for togetherness. And for centuries, the Javanese communities in Indonesia have lived by the principles of Guyub. This is an ancient concept that brought individuals together in happier, healthier communities. So the concept drives families to come together in harmony and teaches individuals to put the self in an existential context. So it transcends an understanding about who you are internally as well as where you are in connection with the people around you. So we seriously need to live in Guyub, especially during the COVID era. So headed by the Asian Center's Office of the Assistant to the Dean for Research and Publications, this webinar is organized to feature various aspects of life in time of COVID-19. For our first webinar, we are fortunate to have His Excellency Ambassador Michael P. Yong Tu as our resource person and complemented by one of our, I may say, influencers today, Prof. Guido David, as our reactor. So Dr. David's presence is facilitated by Prof. Ranjit Singh Rai of UP Okta Research. So this afternoon's activity will discuss Taiwan's successful containment of the pandemic through various public health and policy measures. Thus, this webinar shall also aim to become the platform for sharing the best practices to respond to the pandemic as recommendations for the Philippines. So it is my privilege to welcome you to this afternoon's webinar. Please take advantage of this opportunity to listen up close and personal to the, I may call, rock stars of COVID-19 representative, for instance, of the Taipei Economic and Cultural Office, Ambassador Michael, and of course, Prof. Guido, whom you see frequently now in the television because of the COVID-19. So stay tuned and enjoy the lecture. Terima kasih banyak, Sheshe, and Madamo gid nga salamat.
Thank you very much, Dr. Santarita. So before we start, I will just a few house rules or guidelines. So Currently, we are using Webinar Ninja. It's a browser-based platform. So questions should be posted on the Q&A panel just below your video screen. So if you're using a desktop, you'll have to scroll and then write down your questions at the Q&A panel. Questions will be answered either live or through comments in the same panel, in the Q&A panel. Okay. The chat box is also available if you have messages to your fellow attendees or to our speakers. And we understand that we may have differing opinions on the topic. However, we would like to remind everyone that this is an educational discussion and everyone is expected to express their thoughts in a professional manner. Okay. So let me introduce now our main speaker for this afternoon. Okay, our speaker for today is the representative of the Taipei Economic and Cultural Office in the Philippines. He assumed office in 2018. Prior to his appointment, he served in various positions in Taiwan's Ministry of Foreign Affairs, such as the Director General of the Department of International Organizations, and an APEC senior official from 2015 to 2018. He earned his bachelor's degree in diplomacy and a master's degree in Chinese studies from the National Cheng Chi University in Taiwan. He is also a senior fellow of Harvard University. So let us welcome Ambassador Michael Pei-Yung-Su.
Thank you. Thank you very much for your very kind remarks and introduction of myself. Good afternoon, everybody. First of all, I would like to express my appreciation to Dr. Jofei Santa Rita, Dean of Asian Center, University of the Philippines, for holding this timely event and for inviting me to share what Taiwan has been doing against the COVID-19 pandemic. Here in Taiwan and around the world, people are closely tracking the spread of coronavirus. We know how serious it is, its rate of infection, and the unfortunate number of deaths. Near half the world is in lockdown. Billions are discouraged from leaving their homes. Taiwan is fortunate so far, thanks to an early and active campaign to diagnose, track, isolate, and mitigate cases. The impact to our daily lives has been minor. Now, let me move to the presentation slide, and I would like to share with you for today's event. The next slide, okay. My outline for today's presentation, including five parts. The first one is the Taiwan model. The second one is lessons learned. And the third one is international cooperation. And the fourth one, I'll talk a little about Taiwan and the World Health Organization. And the last part is the cross-strait relation. Now let's move to the next slide. First, I would like to share with you the current situation of COVID-19 pandemic in Taiwan. As you can see, as of September 14, 2 days ago, 2020, the number of persons tested in Taiwan was 89,827, and the confirmed cases is just close to 500, is 499, and the release from isolation, the confirmed cases who has been released from the isolation, the number was 476. It means 95.3% recovery rate, and the death number is 7. But the risk of imported cases remains. Next slide. Here, I would like to show you some photos regarding the life in Taiwan. I would like to say, fortunately, the life in Taiwan has returned to normal. As you can see, the first one, the top left photo, you show the public transportation operates in normal routine. This photo shows the Taipei transit system, the MRT in Taipei, and also same thing in Kaohsiung. But to prevent the potential hazard, the government asked people to wear masks if keeping social distancing is not possible. So most people now, when they take the public transportation, they still wear face masks. Then you can see the top right one is the students go to school. Schools in Taiwan never shut down. We are now even allowing international students studying for degrees coming back to Taiwan to continue their studies. And you see the bottom left. The bottom left one photo shows people still enjoy going to night markets, shopping and eating in the restaurant. And in Taiwan, the bottom right one photo shows people now could watch the baseball game because now is the season. And we are able to allow mass gathering, including go to the movies, concerts, exhibitions, and any kinds of activities. Since the pandemic situation in Taiwan is stabilized, starting from June 7, 2020, we eased restrictions. At the same time, my government still reminds the general public to wear masks if necessary, and also keep social distancing and wash hands frequently. The next slide. Now I would like to share with you the Taiwan model, the 3 T's. This tells us why Taiwan has been so successful in containing the pandemic. The first one is transparency. From day one, Taiwan's Central Epidemic Command Center, we called it CECC, Central Epidemic Command Center, which was reactivated on January 20, 2020. And this CECC, led by the Ministry of Health and Welfare, equivalent to your DOH, has been holding a daily briefing, sometimes, if necessary, even 2 daily briefings. The CECC tries its best to inform the general public of the most updated information on the COVID-19 situation, both in Taiwan and around the world. And in the meantime, people in Taiwan can easily access the most updated and correct information. They also understand what the government's policy and measures are. Then let's talk about the second important element, it's trust. With transparent information and the free flow of information, people in Taiwan could get the updated and the correct information about the COVID-19 situation domestically and around the world. Because of this transparency, people in Taiwan, they trust our government, and they also voluntarily to follow the rules, and even they do more than government asks for. People are wearing masks, shops, schools, institutes, companies, and department stores. They take measures. For example, they try to measure body temperature of everyone, including students, visitors, employees, and customers. And our Centers for Disease Control also set up hotline for people to call in for consulting with any health-related issues. We even noticed that people, including OFWs in Taiwan, there are now more than 150,000 OFW in Taiwan, to report the COVID-19 related information. The government of Taiwan cannot win this pandemic battle alone. It's because our people, they work together with the government, and they are willing to cooperate and share the burden that win this battle together. And the third important element is technology. Taiwan is a country with advanced ICT research and development and manufacturing capabilities. We are able to design a system for travelers to enter quarantine data via mobile phone and mitigate the data to our tracking system. We also use digital fence to monitor the movement of our people in home quarantine. The government merged big data in our National Health Insurance and the Bureau of Immigration to design the high-risk patients warning system and the real name mask rationing system. I especially would like to mention that Taiwan started implementing our national health insurance back in 1995. So in the past almost 20 years, and Taiwan has accumulated a lot of experience, and we also learned a lot from the implementation of our national health insurance. And the Field Health Corporation was also established back in 1995. So we do hope that Taiwan could share our best practice with the Philippines, especially how to use the IT technology to to do a good job for the national health insurance implementation. And I would like to say, with the concerted efforts and ongoing cooperation among the government, private sectors, and the medical professionals, and the society at large, Taiwan is able to contain the spread of COVID-19. Next slide, please. Now, I would like to share with you some major policies and measures we have taken in the past 9 months. The first one is border control. What we have done in border control? On December 31st, 2019, body temperature screen on arriving passengers from Wuhan, China, has been taken. And we gradually expanded to flights from China, then to all incoming flights. It means all the incoming passengers, when they enter Taiwan, before they go through the immigration, they have to have their body temperature measured to make sure they don't have the COVID-19. And since January 27, 2020, all Chinese citizens have been banned from entering Taiwan. And starting from March 19, 2020, all foreign nationals is not allowed to enter Taiwan unless documents of granted entry are provided, and that all inbound travelers will be subject to a 14-day period of home quarantine after entering Taiwan. If at your home, you don't have an individual room with separate toilet and a bathroom, you cannot do the home quarantine. You have to go to a quarantine hotel. And the 14-day home isolation quarantine is the way we try to protect people from those people who have close contacts with the confirmed cases. And we also set up quarantine procedure, locations, and the digital fences. And we mobilize a number of taxis for the sole purpose of transporting passengers from the airports to their quarantine locations, including quarantine hotel and their own homes. We also designate the hotels into quarantine hotels for people's houses which do not equipped with independent toilets or living with family members with high risk of infection, like a senior citizen above the age of 60 and young children below the age of 12. We also execute contact tracing of the confirmed cases completely. We try to avoid the spread of the virus very cautiously. And we also mobilize the health care system, like you can see in the slide. 20,000 isolation rooms with 14,000 ventilators were ready, even when we started all the preparation work for the fighting against COVID-19. And And the next slide. Now I talk about the enforcement of social distancing. The enforcement of social distancing, we urge our people to keep a queue distance, to try to avoid a large-scale gathering. Because I mentioned, our CECC, the Central Epidemic Command Center, they have daily briefing. They buy airtime to try to educate our people to be alert on the COVID-19. So our people, many times, they voluntarily tell each other, don't attend any large-scale gathering. Sometimes, they do not attend any large-scale gathering. It's not because of the government order, but it is because people, they have the awareness, they have to protect one another. And our people also is trying, they are trying their best to keep social distancing. In the meantime, the government also try to help our people. We provide financial support for families who are in need. We provide financial support and the mechanism for our private sectors in need. And then I would like to say, we also try our best to do the research and the development, and especially with the vaccine development. Fortunately, several companies that in Taiwan, they have been doing quite well on the research and development of the COVID-19 vaccines. One company is called, the name is Adimune Corporation. They now work together with your Department of Science and Technology. And we hope to see this cooperation could become, a very good, corporate project, between Taiwan and the Philippines. I will give you more details later. Next slide, please. Okay, now I would like to share with you some epidemic new life movement. Even Taiwan has been so successful in containing the COVID-19 pandemic. We are still very cautious, because you never know, in some countries, the epidemic, come back again after they, lift their lockdown. And so we have a so-called epidemic new life movement. You can see as the photo shows, we still, ask our people to wash their hands frequently. And we also tell our people we have to keep social distancing. Outdoor is 1 meter and indoor is 1.5 meter. And we also tell our people, whenever you go, now we can see like in the Philippines, when you go to a shopping mall, you go to a store, you have to, write down on a piece of paper your name, your contact number, and what's the date you, enter this store or this shopping mall. And we do the same thing in Taiwan. And so we try to tell our people, you have to be responsible, not only for yourself, but also for other people. So that's the epidemic new life movement. Next slide, please. Okay, now I would like to share with you what lessons we have learned in the past 9 months. And I would like to say the first is proactive deployment and in advance. The second one is public messaging. The third one is mobile phone tracing technology. The fourth one is national health insurance. And then the financial relief and the economic activities, and also the home quarantine support system. Let me talk about it, item by item. For the proactive deployment in advance, we increase our face mask production from February. In January, we could only produce 1.8 million pieces of face mask per day. But until the early June, we could produce 20 million pieces of face mask per day. So it is enough for our people to buy the face masks. And for public messaging, like I mentioned, we have the CECC daily briefing, sometimes even twice a day. We want to make sure our people, they can get the update and in time and the correct message. about the situation of the COVID-19 pandemic, both in Taiwan and around the world. And we also used to use the modern technology. We use the apps, of the mobile phone to trace, the persons who have had, close contact with confirmed cases. But here in the Philippines, you still try to hire more manpower to trace, those people who have the close contact with the confirmed cases. But in Taiwan, we use the mobile phone apps. And talking about the national health insurance, like I mentioned, we started this national health insurance back in 1995. So we have established big data, and we use this big data together with the big data of our immigration agency. We combined so we can successfully trace every passenger, inbound passenger, and also our own nationals, whereabouts of them and who they have met with. So this information is very, very helpful. And in the meantime, talking about the financial relief and economic stability, my government, know that the pandemic has affected the economic activities. So we try our best to help our private sectors and our people. For example, my government provides 1,000 NT dollar, which equals 1,600 pesos per day for home quarantine people. Also, for those people, they have to go to the quarantine hotel, and everyone could receive the 1,000 NT dollar subsidy, per day. And we also designed cash disbursements, relief subsidies, and a low interest loan for companies and for people in need. And to further boost the economy, my government plans to push bigger and bolder and faster infrastructure projects. And it will also announce a series of measures to encourage spending and domestic travel while bringing consumers back to shopping areas, especially for domestic travel. I think now the Philippine government is also trying to encourage domestic travel, and I think that is very helpful. And I also believe, in the Philippines, your barangay captains, they are very capable. I think, they can help to monitor and care for quarantine the people. Next slide, please. And now I would like to share with you the international cooperation. There are three parts of the international cooperation. The first part is medical supplies donation, and the second part is experience sharing, and the third part is vaccine research and development. Talking about the medical supplies donation, until this moment, Taiwan has donated more than 51 million face masks to more than 80 countries, including 1 million face masks to the Philippines. And I also would like to mention that the local Taiwanese communities also donated medical supplies, the PPEs, to frontline health workers in the Philippines, especially in Metro Manila. And other than the donation of medical supplies, and we also have held many webinar like this one with different countries to share Taiwan's experience on fighting against the COVID-19. And we also learn from other countries about their best practices. And this achievement allowed my government to work together with more countries, and also to let more countries know how Taiwan is trying to fight against the COVID-19. And talking about the vaccine research and development, international collaboration is important. Particularly, I would like to thank the Philippine government. Your IATF passed a resolution 39, and they allow two Taiwan institutions join together with your university in the vaccine research and development. And the two institutions in Taiwan, the first one is Autoimmune Corporation. It's a private company. And the second one is Academia Sinica. I especially would like to mention the Autoimmune Corporation because this corporation, their COVID-19 vaccine now is in the first stage clinical trial in Taiwan. They already got the permit from our FDA, the Food and the Drug Agency, and to conduct the first stage clinical trial. And the second stage clinical trial will also be done in Taiwan in this coming November. And now Autoimmune Corporation is trying to work together with your government to have the third stage clinical trials to be conducted in the Philippines. So I hope to see they can do this third stage clinical trial as they targeted in early next year. The next slide. Okay, now I would like to show you, some examples of the international cooperation. You can see on the top left is I and some Taiwanese compatriots. We went to Quezon City, donate PPE to Honorable Mayor Joey Belmonte, and on the top right is the photo at the cargo terminal of Naiya Airport, Naiya 1. And I and the vice chairman of the Manila Economic and Cultural Office, we have this handover ceremony just at the cargo the cargo station. And then two other pictures now I cannot see, but I think you can see. The bottom left is one of the seminar held before, and then the bottom right is the vaccine we are producing in Taiwan. Next slide. Okay, now I would like to talk. It's okay. Talk about a little about WHO. As you can see in this photo, Taiwan is wrongly categorized under China. It's Taiwan, China. That just shows how Taiwan has been treated unfairly by WHO. Even they gave us a wrong designation. And I think you are aware, China never governed Taiwan for a single day. And in Taiwan, the Republic of China, we have our own government, and we have a government, democratically elected by the 23 million people in Taiwan. And so even WHO has been treated Taiwan so unfairly and so badly, but Taiwan will continue to seek participation in the World Health Organization. We believe that having undertaken successful actions to mitigate the coronavirus, Taiwan has a lot to share with the international community. Given that pandemics recognize no borders and make no distinctions between nationalities, we think it is irresponsible for the World Health Organization to continue to limit Taiwan's participation. We have noted that while we have made some progress, significant hurdles remain. I would like to point out one area that is very important for Taiwan is information exchange. Without timely access to critical information about the coronavirus, Taiwan risks becoming a gap in the global health system, undermining the very purpose of the World Health Organization's existence. And this also puts at risk everything we have worked so hard to accomplish, both in Taiwan and together with other like-minded countries, including the Philippines. We strongly urge the World Health Organization to allow Taiwan's full participation in its meetings, activities, and mechanisms for the welfare of all human beings in the world. And the next slide, please. Okay, now I would like to touch on the cross-strait relations. Here, I would like to point out Her Excellency President Tsai Ing-wen in her inauguration speech in last May, mentioned 4 principles in our management of cross-strait relations. That is peace, parity, democracy, and dialogue. Peace means we will seek continued peace with Beijing and call for the renunciation of force to settle our differences. Parity requires that both sides should not deny each other's existence. Democracy means Beijing must recognize that Taiwan is a democracy whose future is decided by our own people. And the dialogue means we will not refrain from dialogue with Beijing that is not based on political preconditions. With these 4 principles, Taiwan will seek to continue our engagement across the Taiwan Strait. We will always be willing to work together in the interest of peaceful coexistence and to prevent a downward trend in cross-strait relations. We will always acknowledge the historical and the crucial ties that exist across the strait. And we will never stop believing that there can be a better future ahead, where both sides can share in each other's success and accomplishments. But before this can take place, we must also be realistic and take stock of our differences. Taiwan has become a full-fledged democracy, and our 23 million people have the right to determine our own future, which is antithesis to the position of Beijing has taken. Consequently, we must ensure that cross-strait interactions do not jeopardize our freedoms, democracy, and the way of life. The people of Taiwan expect nothing less from their democratically elected government. Relations, according to the Constitution of the Republic of China and the Act governing relations between the people of the Taiwan area and the mainland area. This has been Taiwan's consistent position for maintaining the peaceful and the stable status quo in the Taiwan Strait. And I think now it is the end of my presentation. And I would like to thank the Asian Center of the University of the Philippines again for holding this timely event. And I thank you. And also, I would like to thank the attendance of so many participants. I learned from my colleague Sonia Lu, almost 500 people registered for this event. So I hope later we can have some discussion. Thank you very much.
Okay. Thank you very much, Ambassador Su, for that very enlightening lecture. So I'm sure we already have some questions in mind. Please do type your questions in the questions panel below the video screens. And before we proceed to the open forum, let us first hear some insights regarding our topic, COVID-19 pandemic. So let me introduce our reactor. Our reactor for this afternoon is currently a professor of mathematics in the University of the Philippines. He is also an adjunct professor with the Asian Institute of Management. He obtained his master's in mathematics and PhD in biomedical engineering at the Texas A&M University. He also served as the director of Computational Science Research Center of the University of the Philippines in 2010. He was awarded one of the 10 outstanding young scientists of the Philippines. He currently holds the title of UP Scientist. His areas of research include mathematical modeling, artificial neural networks, biomechanics, numerical analysis, stochastic differential equations, mathematical biology, and game theory. In addition, his teaching and research, he also co-hosts Pinoy Scientist on Radyo Agila. Since April 2020, he has been involved in the COVID-19 modeling and forecasting as part of the OCTA research group, which provides decision support for the national and local government. So let us welcome Professor Fredegusto Guido David.
Thank you. Hi, good afternoon. And also, thank you to Ambassador Michael Su for the wonderful presentation. And I'd also like to thank, of course, Dean Santarita for the invitation. And also, good afternoon to all the guests, viewers of this webinar. Before I begin, I'd just like to mention that I've been to Taiwan a couple of times as part of a research undertaking. It's a collaboration between Taiwan and the Philippines. So several faculty from the University of the Philippines, mathematics, and some other institutions visit Taiwan every few years as part of a collaboration of working together. And Taiwan has been very supportive of pushing the academe, pushing science in the Philippines. And we have been very appreciative of this effort by the Taiwanese to support the Philippines in this regard. And I also echo the sentiments of Ambassador Michael Su. For us to recognize the democracy of Taiwan, I've had several friends also. When I was in Texas, I've had several friends who are from Taiwan, and definitely I respect where they're coming from, that they have a sovereignty, they have a democracy, and we should recognize their contributions to the world. And hopefully the United Nations will notice this. So I'd like to share my screen so I could begin my presentation. I'm not sure if you could view this. Yes. Okay. Okay. Sorry, I'm on the wrong slide. So okay. So I apologize. I'm quite new to this platform, but I just like to share a few slides, at least to show the state of the pandemic in the country, and also serve as a rough comparison between the way the pandemic was managed in Taiwan and in the Philippines. So just a quick disclaimer. So although we are UP faculty, we're doing this as part of the OCTA group, and the opinion here is primarily our own opinion and not of the university. Okay, and just a brief outline. This is just a very short presentation. We're just going to go over what's been happening in the Philippines regarding COVID-19, and a brief comparison with Taiwan. And we want to also look at a little bit at testing in particular in the National Capital Region, and just go over some of the challenges faced by the country. And this is as of September 14, and this is the number of new COVID-19 cases in the Philippines. And we can see that it's been almost 6 months, well, since the lockdown, and instead of controlling the pandemic, the pandemic has actually increased since end of May. Okay, the number of new cases has risen to as much as 7,000. Although recently we have reduced the trend, it started to decrease, But we're still getting an average of about 3,000 or more cases per day. So the pandemic is still a serious threat in the Philippines right now. And here, I just like to show the reproduction number that we calculate. This is for the entire Philippines, and we use several ways, methods to calculate the reproduction number, depending on the data. I mean, based on the data provided by the Department of Health. And as we can see, the trend has been decreasing. So, in fact, the reproduction number has gone below 1 recently, although it's getting close to 1. And I just like to remind people, especially those who are not very familiar with epidemiological models, that the reproduction number represents the average number of transmissions of an infected individual. And we use the reproduction number as we use it as a method to show the state of the pandemic, if it's spreading or if it's slowing down. In some ways, we can use it to show flattening if our definition of flattening is flattening the number of active cases. But that's for a different thought. But definitely, we use the reproduction number R naught to see where we are at in the pandemic. Is it slowing down? Is the trend still increasing? And here's just a brief comparison of Taiwan and the Philippines. And as you can see, the population of the Philippines is almost 5 times greater than the population of Taiwan. Philippines is it's a larger country, but it's an archipelago, whereas Taiwan is mostly it's one island. The first case of COVID-19 in Taiwan was reported on, at least based on the data I'm looking at, on January 21, while in the Philippines it was January 30. So Taiwan had the pandemic earlier than the Philippines. Currently, there are 16 active cases in Taiwan. In the Philippines, there are currently, according to the Department of Health data, 57,000 active cases. The number of recovered cases is 207,000 in the Philippines versus versus 476 in Taiwan. And the number of people who have died from the COVID-19 is more than 4,600 in the Philippines and just 7 in Taiwan. Of course, just the sheer number shows that the scale is much larger in the Philippines. In total, we have 269,000 cases in the Philippines, including active, recovered, and those who perish. In Taiwan, the total is 499. Here, we calculated the effective reproduction number for the entire duration, basically from the start to from the start to present. And although it may seem like the difference is slight, it's 1.72 in the Philippines and 1.3 in Taiwan. This slight difference actually spells the difference between 270,000 cases and 500 cases. So that is a big deal. I mean, because the small difference in reproduction number causes an exponential increase in a way that it's increasing exponentially and causing the numbers to go up much higher compared with a slightly lower reproduction number. And then the effective CFR, or case fatality rate, which is the number of deaths divided by the number of recovered plus the number of deaths. So we don't divide this by the total number of cases because some of the active cases, we still don't know what will happen with them. So technically, when we compute CFR, we divide the number of deaths by the number of recovered plus deaths. And we see about 1.45% CFR in Taiwan and about 2.2% in the Philippines. So I just like to go over a little bit about all on the National Capital Region, which is the nation's capital and primary economic center of the Philippines. It has about 13% of the Philippine population, but in terms of economic activity, it has about 30%, 38% of the gross domestic product of the entire Philippines. And in terms of the COVID-19 impact, 55% of the cases are in the Philippines. So this presents a serious problem for the Philippines because the economic center is in NCR, and part of the challenge, of course, is Manila is the most densely populated city in the world. And again, the main problem here is that the epicenter of the pandemic is already in the nation's capital. It's where the economic capital is. And if we compare that with a country like, for example, China, when the pandemic happened in Wuhan, the main concern for the country is to prevent the pandemic from getting into the nation's capital, or at least the major economic centers. And that's why a lockdown was imposed to prevent the pandemic from spreading into Beijing and Shanghai, and maybe even Hong Kong. So Guangzhou also. So those are the major trade centers in China. Of course, Wuhan is also a major trade and development center, but it's not the capital. It's not as major as Shanghai or Beijing. And that's really one of the purposes of having a lockdown. It's like isolating the small part from and preventing it from infecting one of the major economic sources or sources of livelihood. And unfortunately, of course, that's not possible in the Philippines because the pandemic is already centered in Metro Manila, in NCR. Here, I just want to go over a little bit on the testing. And as you can see, back in May, this is in NCR. There were only about 5,000 tests being conducted in NCR. This has increased to more than to almost 25,000 as of the present. But we feel that testing can still be scaled up, and the reason for that is if we look at the positivity rate right now is still at around 11 to 12%. So it's good. It was as high as about 19%. And positivity rate tells us how many people test positive out of all the tests that are conducted. So out of 100 tests, 11 test positive. So a positivity rate of about 5% is ideal and 10% is acceptable. So this means that we still have to scale up testing in order to achieve this 10% positivity rate. And then the pandemic has to be further reduced to achieve a 5% positivity rate. So, and then we also look at the hospital occupancy, and we can see that over the past week, the hospital occupancy in the NCR has actually reduced below the 70% critical levels, but it's still close to 70%. It's still above 60%. So we are not out of the woods yet. And then here are some of the challenges, and it's really informative to hear about what happened in Taiwan and how they were able to manage the COVID-19 pandemic very well in their country. In fact, Taiwan could be one of the model countries to look at and to study if we want to learn how to manage a pandemic well. And in contrast with Taiwan, here we see some of the challenges we faced in the Philippines, and this could be some of the reasons why our pandemic response was not as effective as it was in Taiwan. So one of the problems, of course, was in chain of command. What that means is chain of command from the national government to the local government, and even the various departments or institutions within the government. For example, the different departments, for example, coordination between different departments of the government. Second one is, of course, Philippines did not close its international borders as early as Taiwan. So Taiwan had a very fast response to the upcoming pandemic, and that they closed their borders or early, very early, in fact. And this helped reduce the number of foreign travelers who brought the disease in Taiwan. And in the Philippines, as I showed you in the graph a while back, it took some time to scale up testing. Now we're up to about 25,000 tests per day in National Capital Region, but we still need more tests because of the positivity rate. One of also the successes that we noticed in Taiwan is their contact tracing. So they have the contact tracing apps. In the Philippines, did not have contact tracing apps. The process of contact tracing was primarily manual contact tracing, and this is very problematic, especially once you increase the scale of the pandemic. If you're dealing with maybe 10 cases, 20 cases a day, then it's very, it's possible to do contact tracing. But once you get to 3,000 cases per day, it's really very difficult to do contact tracing, especially if you're not capturing asymptomatic cases. We also had problems with quarantine and isolation protocols. So we had to fix those problems. And then we also had cases wherein we had returning overseas workers, which caused spikes in cases in certain regions. And this is not to say that, we should not have let overseas workers return. After all, overseas foreign workers are, part of the lifeblood of the Philippine economy. Of course, it has more to do with the implementation of allowing foreign or people from other countries to return to the Philippines. So I think the last point, and this is probably the most important one, was that the Philippines was not experienced in handling a pandemic, unlike Taiwan, which I believe learned a lot from SARS and MERS. In the Philippines, on the other hand, SARS and MERS hardly affected the country. In fact, I believe we only had less than 20 cases of SARS back in 2003. And that may have cost us as a whole, I mean, we're not just talking about the government, but also the people, we essentially underestimated the virus. So we were not prepared for it, but we also underestimated it in that we underestimated the threat of the virus. And I think that was what's important. And I think we should learn a lot from our mistakes and from the way Taiwan handled its pandemic, so that in case this happens in the future, then we should be able to we should be more prepared in managing a future pandemic, and we should have we should be taking the preparatory steps once we see the first signs of upcoming pandemic. So I think that covers the presentation. So again, thank you for having me as a resource person, and I'm sure Ambassador Michael Su and myself will be happy to answer questions.
Thank you very much, Professor Guido David, for that. And by the way, I'm Michelle Palumbarit, Assistant Professor of the Asian Center, and I'll be moderating this Q&A portion. So I'll be reading your questions, and Ambassador will answer them. Okay, Ambassador, here is the first question.
Okay.
Which other countries are working or express their interest to work with Taiwan in COVID-19 vaccine R&D?
You mean how many countries, or could you repeat your? Yeah, because there's a echo in in your voice. Yeah.
Okay. From Jose Rivera, and the question is, which other countries are working their interest to work with Taiwan in the COVID-19 vaccine R&D?
Okay. Actually, we work with some European countries and also United States and also the Philippines. So we work with several countries regarding the R&D of the COVID-19 vaccine, because we know the vaccine is so important. So that's why, and we cannot work alone. We have to work with partners. So actually, we work with other countries. Indeed.
Mm-hmm. Okay, thank you, Ambassador. Another question is, what are the impacts of COVID-19 border measures to President Tsai's new southbound policy?
Oh, good question. And actually, this COVID-19 pandemic, does, in fact, affect, our new southbound policy, because many countries, they have their lockdown and they have the border control. For example, even the Philippines, now there are some Taiwanese businessmen, they ask for help because the visa type they have, doesn't allow them to come back once they are out of this country. So they hope to see the border control of the Philippines could, relaxed, as early as possible, so they can come back. They do have their business here. They have been here for a long time. They have been living here, but just because of the visa type they are having, they couldn't come back, for the time being. So, so the border control measures of the ASEAN countries, including the Philippines, does affect the new southbound policy. But luckily, we are now having more webinar and more video conferencing. We try to use internet to conquer the barriers caused by the COVID-19. So, for example, I have been having the video conference several times, only in the past 2 weeks. So what we try to put through the cooperation projects with the new southbound policy countries, if not physically, but virtually.
Mm-hmm. Thank you, Ambassador. That was a question from Mr. Watchon. Here's another question for you. How did Taiwan handle asymptomatic COVID-19 cases? From Hannah Pagilla.
Okay. For the asymptomatic, cases, okay. I would like to say in this way, because as I mentioned, in my presentation, we had the border control quite early, and from March 19, we prohibited, the foreign travelers, coming to Taiwan. But now we are trying to lift the ban, little by little. And for the older cases, we try our best to identify the confirmed cases, even is with asymptomatic. That's why we try to have the PCR testing of those suspicious cases, and we are very careful about the isolation and the quarantine measures. And so for the travelers, inbound travelers, they are still having to experience a 2-week isolation or quarantine in Taiwan. And in Taiwan, domestically, we also urge our people, whenever they feel something wrong with themselves, they have to report, to our CECC or to our, CDC. We are trying every way to make sure, any person, either it's a confirmed cases or it's confirmed cases, but with, is asymptomatic, they can get their, treatment. I give you one story. One gentleman, living and working in Manila. He was confirmed the cases, and he got the treatment here, and then he was released by a hospital, and then he went back to Taiwan. And after the entry, we tested him again, and we found out that there are still some very minor or very limited number of the virus inside his body. So we put him in hospital for several days until he's totally recovered and treated. So that's one of the case. It's a already recovered case here in Manila. But even when he entered Taiwan, we still ask him to do the PCR testing. We want to make sure no one will be neglected.
I see. Thank you, Ambassador. Here's
Yes.
another one from Alexandrino Malinin. How does Taiwan cope with how its justice system and courts function during this new normal? Do you now conduct face-to-face hearings in courts or still online hearings through video conferencing?
Okay, good question. Like I mentioned, in Taiwan, we never shut down our schools. So now the school is already, started. So we have the face-to-face teaching, not online teaching. Yeah, so the students, they go to school, from primary school to university. And also even foreign students, now they can come back if they already pursue degrees in Taiwan. We allow them to come back to finish their degrees. So all the students in Taiwan now, they go to school and have face-to-face teaching.
I see, I see. Thank you, Ambassador. I believe this question is to Dr. David. It's from Jose Tabada. I'm trying to determine the factors that determine country performance in controlling COVID-19 using population density, the Human Development Index, physicians, population, health budget, GDP, and corruption perception score as independent variables. What variable should not be there and what variable should be omitted?
Yes. Yes. Thank you for the question, Michelle. It seems like the person asking this question is probably interested in doing a model or some kind of multilinear regression or machine learning analysis of country performance for COVID-19. Among those variables mentioned, I would not remove any variable yet, because when you're doing these things, you should basically put in as many variables as possible initially, and then try to streamline the variables that you use once you get your results from your analysis. For the variables that are missing, I'm not sure which data are available, but I haven't checked which data are available. But basically, you should try to put in as much data as possible. Whatever you have there, you can just put all of them in and just streamline the model later once you get results that says that certain variables have low scores in the analysis. Sorry, it's a technical answer.
Yes. Oh, Actually, now we have direct travel from Taiwan to mainland China and also to Hong Kong. And we have 5 points in mainland China. I mean 5 airports in mainland China. 2 in Shanghai, 1 in Beijing, and then the other 2 airports. Actually, people can still travel from mainland China to Taiwan, from Taiwan to mainland China. As you are aware that there are more than 1 million people, either they do business in China or they study in China. And so even some spouses of the people who work in mainland China from Taiwan. So that's why the traveling between the 2 sides is still there. And also same thing between Taiwan and Hong Kong. You mean the exchange of information, or because I cannot hear the question clearly? Also because of the echo. Okay. Okay, thank you for this very important question. Even WHO precluded Taiwan's participation in its meetings, mechanism, and activities. And actually, Taiwan joined the IHR back in 2009. It's International Health Regulation. It's a mechanism set up by WHO. And we always try to send information through the focal point of the IHR in Taiwan. We provide information. In last December, our experts, who traveled to China, to Wuhan city, to find out what's happening there, and when they didn't, receive, positive response from their counterparts in Wuhan, when they came back, they actually also informed the WHO through the IHR focal point and try to inform WHO there was a new pneumonia, happening in China and deserve WHO's attention. And so because of the WHO's, treated Taiwan unfairly, we also go through bilateral arrangement to share information with many other countries. And through the bilateral arrangement, Taiwan could still, get some information and exchange information. But like I mentioned in my presentation, information exchange is still very important for Taiwan, especially through WHO. So that's why I said, Taiwan still urge WHO, the World Health Organization, to allow Taiwan's full participation in the mechanism, activities, and the meetings of WHO. Even for the technical meetings for health experts to attend, WHO always give us some not only the turn down of our request, but also sometimes give us very much difficulty. So the information exchange is so important. So if WHO doesn't allow Taiwan to have a better information change, Taiwan is trying very hard go through the bilateral arrangement to have information regarding pandemics. Sorry again, it's for the echo. Yeah, the echo was there again. So Taiwan's
Military.
military. Okay. I think the military is a part of our society. Actually, for the military, maybe you are aware that we have the friendship fleet, every year to visit different countries, and some of the, our, commissioned officers, on the vessel, they got the COVID-19. So my government asked them to come back. And so the military fully cooperate, with the government, to make sure, we try our best, to make sure that our soldiers, they are, safe from the COVID-19. And also we do the infection, wherever we find, there was confirmed cases, the disinfection, we do it completely and thoroughly. So the military now they are so far they are okay, and like other private sectors, they fully comply with all the measures taken by the government. Yeah, they also do the body temperature monitoring, and also they try to keep social distancing, and without the interference of their daily training. So our military, they are on high alert. Okay. I would like to say it is so difficult to strike a balance between economy and also the pandemic prevention, or to contain the pandemic. So for example, in Taiwan, my government, we didn't have the lockdown, because we know if we have lockdown, the economy would be heavily affected. So I think the government, in the meantime, try to contain the COVID-19 pandemic. I think, the government also, has to find the way to provide the opportunity to the private sectors, using all the resources and the vehicles they have to help them to recover from the pandemic. And so for Taiwan, like I mentioned, my government is trying to use the infrastructure construction and other, stimulus package to make sure, our private sector could recover from the pandemic.
Thank you, Ambassador. I think this is also a follow-up question or comment for Professor Guido David. It's from Tabada, Jose Tabada. The 3Ts model proposed by the ambassador is very elegant and seems to capture the Taiwan strategy. Which of the three is absent in the Philippines?
You mean among the 3Ts, which
Yes,
one
yes.
is most important,
Which
or
absent in the Philippines? Which of the three is not present in the Philippines?
Oh, okay. It's a difficult question to answer. The 3T. I think the Philippine government is trying its best, to also well inform your people. I know you also have the daily briefing by your DOH. I think for the transparency, it has been conducted by your government. And then for the technology part, I think maybe there is some room for improvement. Like I mentioned, you have your field health corporation, and the field health corporation was established back in 1995, and Taiwan's national health insurance, was implemented also in 1995. So I think for the technology part, Taiwan would like to share with the Philippines, especially in the national health insurance IT system. That's one of Taiwan's advantage. So for this part, I think Taiwan would like to work together with the Philippines. Then for the trust, I encourage your people, try your best to trust your government. Only when you trust your government can do its best to help you. I think it's a two-way, traffic. The government, I believe, the Philippine government is trying its best to help the people, to help the private sectors. But in the meantime, I think people here should be more disciplined. Now I go out, I go to the grocery, go buy groceries, I go to the supermarket, people, many of them, they don't follow the social distancing. Yeah, and even sometimes you go to the traditional market, I mean the wet market, you see some people, they don't wear a mask, face mask, or they just wear the cloth mask, which doesn't, protect you. So I think, the people should also try to work together with government. People in Taiwan, we are very disciplined, because of the cooperation between people and government. Then we have the trust. So the trust is not a one-way traffic, it's two-way. Thank you.
Thank you, Ambassador. Let me go to Professor Guido. What are your thoughts on this, Professor?
Yes, I'd like to add to that. And those are some great answers by Ambassador Michael. In the Philippines, we had problems with the 3Ts early on. I think treatment was maybe the T that was most effective among the 3Ts. We had problems with testing because we were not able to scale up testing very quickly. And we also had problems with tracing because our tracing was done manually, as I mentioned earlier. So unlike in Taiwan, they had a contact tracing app that is much faster and a lot more efficient to use than manual contact tracing. And once you have a high number of cases, then that becomes very difficult to do contact tracing. But again, I'm talking about initially when we had those problems. Right now, we are getting a high number of tests, and tracing seems to be more improved now, although still not in the level that Taiwan had, wherein they had apps and we don't. And I'd also like to echo Ambassador Michael's comment about cloth masks. They are indeed not effective, and I have been, I've been getting goosebumps every time I see people with cloth masks in indoor public areas, because these have been shown to be not effective. If it's maybe a multi-layered cloth mask, then yes, it's okay. But generally, we should be using N95 and surgical masks, and these have been proven to be effective.
Thank you, Professor David. Ambassador, I think this is a follow-up question from Mr. Rivera. What role did Taiwan's local government, provincial governments play in the COVID-19 response? The Philippines has been implementing a very centralized top-down approach, and I am just curious if Taiwan has been implementing a bottom-up and localized approach.
Thank you very much for this question. In Taiwan, we have the central government, then we have the city government, and we also have, we call it the Li. It's like your barangay. So we have a different layer of the government structure. I would like to say the local government, especially the city mayor, they also bear, great responsibility in cooperating with the central government to make sure their cities are safe from the COVID-19 pandemic. So because of the government, was trying to alert, everyone in our society, this pandemic, is very dangerous, and Taiwan is very vulnerable because we learned a hard lesson in 2003. SARS hit Taiwan badly. And so this time, everyone in Taiwan, I mean, both government officials at the central level and at the local level, they try to work together. And everyone wants to make sure this COVID-19 pandemic will not damage, our economy, further. And everyone wants to make sure, the COVID-19 could not, take more lives, from our people. So that's why the local government, they also play a very important role. They try to make sure in every city, in every barangay, and in every li, the COVID-19, once there is a confirmed case, would be immediately report to our CDC or our Central Epidemic Command Center. So there is a concerted and the well-coordinated efforts, at the different levels of the government in Taiwan.
Thank you, Ambassador. And Ms. Pilapil has a question for Professor David. May I know how reliable a mathematical modeling of the pandemic is based on what you call as the reproduction number? You were reported saying that there is a flattening of the curve in NCR, but shortly thereafter, we in fact saw an increase in the number of COVID-19 cases.
Thank you. That's a very good question, Christine. Yes, we did report the flattening of the curve, and with regard to the reliability of a mathematical model, the reproduction number is actually not a model assumption. It's actually a measurement of how fast the pandemic is spreading, and it's also being used in other countries. For example, in Imperial College London, in Johns Hopkins. So it's actually measuring the rate of transmission. In the same way, if you're looking at a vehicle, you want to measure the speed of the vehicle. So it's something like that. And it's there's no error there, except, of course, if your data is not reliable, then your measurement is only as good as your data. So if your data is not so good, then even the best models will measure something that's incorrect, and that's what they call garbage in, garbage out. But we believe that our measurement is actually accurate, and moreover, we did report the flattening of the curve last week because the reproduction number decreased to less than 1. But also there was 3 weeks of decline in new cases in NCR, and that's not something that there's no mistake in that. We actually see a decrease in new cases in NCR. And now there is an increase in cases, but it's not in NCR. The number of cases in NCR is fairly stable. So actually the surge is happening in Calabarzon, and we have this in our latest report. There was a surge in Bulacan, in Cavite, in Rizal, in Batangas, and there have been many places up north where the surge was happening. So all these places have contributed to the increase in cases. And if you don't believe me, of course, you're welcome to look at the data of the Department of Health. You can see that a lot of the new cases are actually not in NCR, but in Calabarzon, in Bulacan, and in even in other places in Bulacan, in Zambales, Tarlac, and Nueva Ecija. So in NCR, our reproduction number is still below 1. There may be a slight blip in cases, but generally we're still doing okay. I mean, as far as the trend is concerned, we don't have 0 cases yet. The pandemic's still here. We still have more than 2,000 cases a day, but at least we're trending in the right direction.
Okay, thank you, Professor David. To all our attendees, in as much as we want to accommodate all your questions, in the interest of time, we're afraid we can only accommodate 2 more questions. Ambassador, this question is for you. Yes, it's from Mr. Mark Banaag. So much of the best practices that Singapore and Vietnam have now in responding to COVID is based on lessons from their 2003 SARS experience. Are Taiwan's responses to COVID also attributed to lessons from the 2003 SARS experience?
Yes, this is a very good question. Actually, I would like to say the SARS happened in 2003, taught us a lot. I would like to say first, in the beginning of this COVID-19 pandemic, when we learned about it last December, we even mobilized our hospitals. We alert our hospitals to prepare, and also to make sure there would be no in-hospital infection. So all the hospitals in Taiwan, they know how severe this potential disease would be. So for the hospitals, they try their best to make sure if there's confirmed cases, patient, in their hospital to be treated, they can make sure the frontline health workers will not be infected by the confirmed cases. That's one example. And the other one is, we know in 2003, when the SARS happened, Taiwan could not get help from the World Health Organization. So this time, we are not sure whether WHO could help. So we better prepare by ourselves. So from the beginning, we try to take to make sure the necessary measures be taken. Like I mentioned, the border control and also mobilization of the face mask production. We increased the daily face mask production from 1.8 million pieces to 20 million pieces. Only 5 months away. In January, we could only produce 1.8 million pieces of face masks, but in June, early June, we could manufacture or produce 20 million pieces of face masks. So all the lesson we learned in 2003 from SARS, we try to alert our people, including the frontline health workers, to make sure we are well prepared for this COVID-19 pandemic, even from the beginning of this pandemic.
Mm-hmm. Thank you, Ambassador. And this is the last question for you from Francis Arnado. How does Taiwan Labor Department and Civil Service Commission address working force and business activities, both in public and private sectors, in response to the pandemic?
Okay, it's a very good question. Right from the beginning, the Central Epidemic Command Center is a task force. Actually, all the government ministry or departments, they have to assign their official to attend this CECC coordination mechanism, including our Ministry of Labor and also our Ministry of Economic Affairs. So from the beginning, the private sectors, all companies, if you visited any company in Taiwan during the pandemic, even now, first, at the entry, everyone should be measured, their body temperature, and everyone should wear a face mask, and everyone should keep the social distancing. And so private sectors, the companies, they know they have to protect their employees, and they voluntarily abide by all the regulations, adopted by the government or announced by the government, and all the measures adopted by the governments. And so the private sectors, all the institutions, they know the severity of this COVID-19, and so they try their best to work with the government. So I would like to say the cooperation among all the sectors in our society went quite well. That's another important element why Taiwan could cope with this COVID-19 pandemic so well so far.
Okay, thank you very much, Ambassador. Thank you very much, Professor Guido David. I think that ends our Q&A portion. On behalf of the Asian Center, we would really thank Ambassador Xu for your time and for sharing your knowledge and experience with us today. They're very, very much appreciated. And also to Professor Guido David, thank you very much, sir, for your time. We know that you're very busy, but we do appreciate your time with us here. And also to our attendees, thank you very much. And we hope to see you in the upcoming webinars of the Asian Center. And with that, everyone, I wish you a good day. See you again. And ingat po tayong lahat. Thank you very much.
Thank you, Tanay. Thank you.
Thank you.
Thank you.
Thank you. Thank you, Ambassador.
Thank you very much.
So
Thank you.
to our attendees, just a few announcements. So if you'd like to attend more of our webinars, Asian Center webinars, we have 2 more webinars coming up next week on Japanese politics and society on September 22 at 2 p.m. via Zoom, and Borderless Crossing Dilemmas Under the COVID-19 Pandemic, a focus on Filipino and other Southeast Asian workers residing in Japan and heading for Japan on September 23 at 2 p.m. as well. So if you want updates regarding these webinars, you may visit the Asian Center website, follow us, and like our page on Facebook. Thank you very much. Ambassador
Thank
Sue and Professor David,
thank
thank
you.
you very much.
Thank you. Thank you. Yeah, salamat po. Thank you.
Thank you.
Thank
Yeah.
you.
Thank you. Thank you, Jufei. Dr. Jufei. Thank you. 好，结束了。